Let me tell you about an organ in your body. It quietly pulls the sugar out of your blood every single day so your blood sugar stays in line. It stores the amino acids your body comes raiding when you are sick, injured, or stressed. It makes hormone like signals that travel out and talk to your bones, your fat, your blood vessels, and even your brain. It is, in a very real sense, a drug factory, a pharmacy once you are bought with, one you are already own. And here is the part that should bother you just a little. Many people over 50 are slowly letting that pharmacy lose capacity one shelf at a time, and they have been told that is just aging. Not entirely. This video is only for general education, not a personal medical advice. It is not a substitute for assessment by your own doctor. Decisions about any medications, including medical weight loss treatment, are between you and your treating clinicians. Today, I will show you what 4 series piece of research say your muscle is actually doing behind the scenes. Why losing it costs you far more than the bathroom scale will ever admit, and the 2 things that genuinely restock the shelves. I am Dr. Naveen Thiyagu, orthopedic surgeon. And let me start with one number that made me want to make this video, which is 25 to 39%. When people lose weight on newer medical weight loss injections, studies suggest somewhere between a quarter, nearly 40% of the weight they lose is not fat. Yes, it is called fat-free mass, largely muscle. To put that in perspective, authors note that year on year, that rate of muscle loss can be several times greater than the muscle you would naturally lose with aging, which ticks along at roughly 8% per decade from your 40s. Now, I am not here to scare anyone of a treatment that is genuinely helping millions of people. Hold that thought. The nuance matters, and I will come back to it. But first, the simpler question. Why does the muscle matter this much in the first place? Ask most people what muscle is for. They will say lifting things, for strength, looking respectable in a wedding photo. That is true, but it is only a small part of the story. Muscle is a big metabolic organ. It is a reservoir of amino acids, the ones your body pulls during stress, trauma, and infection. It synthesizes and stores glutamine, which your immune system runs on, and it is one of the biggest sinks for glucose in your body. It takes sugars out of your blood in response to insulin, which is a huge part of how you stay out of diabetic range. And then there are myokines. These are signaling molecules your muscle manufactures and release every time it works. They behave like messengers talking to your blood vessels, your fat, bone, immune system, and even your brain. That is the pharmacy, which is exactly why the same paper warns that low muscle mass all on its own, independent of your body weight, predicts worse outcomes, weaker immunity, more infections, slower healing, more disability, shorter survival. The shelves matter. So who is coming to read them? Let me bring in our fictional Doraisamy. He sat down in the doctor's consultation room. He opened his notebook. He was very serious. He said, "Doctor, I have understood everything, that the muscle is a pharmacy." I said, "Yes, Doraisamy, exactly right. Well done." He leaned in, lowered his voice, looked left, looked right, and asked me, "So, doctor, which counter, morning or evening, should I collect?" There is no counter, Doraisamy. You are the pharmacy and you are the pharmacist, and I am sorry to tell you, you are also the medicine. He wrote that down slowly. 3 jobs, no salary. Welcome to the human body. His wife, Meenakshi, without even looking up, said, 30 years I have been telling him this, and now it is in research. Now, the moment I tell you anyone over 50 to load their muscles, I get the same objection, same 3 words every time. But my knees, doctor, specifically knee arthritis, the warm, achy, grumbling knee, surely the last thing you do to a painful arthritic knee is exercise, right? This is where I bring in the Cochrane review. And if you do not know a Cochrane review, these are some of the most carefully done evidence summaries in medicine. They did not run just one study. They pulled in a lot of trials of land-based exercise for knee arthritis. The verdict was high-quality evidence that exercise reduced pain, moderate quality evidence that it improved physical function, measured right after exercise programs. Let me give you the actual numbers because they are more honest than a vague term like it helps. On a 0 to 100 pain scale, the people who exercise rated their pain about 12 points lower than the people who did not. On function, about 10 points better. And here is the line the review itself draws. That benefit is comparable to what has been reported for anti-inflammatory painkillers. The tablets people swallow for very same need. Sit with that. A structured exercise program reduced knee pain in the same general range as anti-inflammatory tablets for pain. But here is the honest caveat, because we always keep this in. The effect is moderate, not miraculous. A few studies noted some temporary extra soreness in the knee or back from the exercise itself. No serious harms were reported, but it is not nothing. And the benefit fades over the months after you stop, which is the entire point. This is not a course of antibiotics you finish and forget. It is the pharmacy. It only serves you while it is open. So how do you build and defend this organ? Here is the big Nature review molecular paper earns its place because it cuts through the noise. First, resistance training is the core stimulus for muscle. The paper explains that weekly training volume, meaning how many hard sets a muscle group gets per week, is one of the main drivers of muscle growth. It cites roughly 12 to 20 weekly sets as a range that can maximize hypertrophy in trained settings. Now, most midlife beginners are nowhere near that. And that's actually wonderful news, because nowhere near means enormous room to improve. Second, protein. The same paper notes that protein intakes of around 1.2 to 1.6 gram per kilogram of body weight per day can complement training programs, training response. Not the cartoon number from the supplement aisle, a specific evidence-based ban. Third, and this is the part one I genuinely love. Why does the training work deep at the cellular level? Two things. One, ribosome biogenesis. Your muscle literally builds more of tiny factories that assemble proteins, and over time, satellite cells, the muscle stem cells parked around the fiber that help repair and remodel the tissue. Train and you ramp up the factories. You call in the repair crew, that's the restock in mechanism. And one practical footnote, the same paper supports creatine. And around 3 grams a day raises muscle creatine stores by about 15% over a month, appears safe for kidney function and consistently improves strength. One of the very few supplements that actually earns shelf space. Mrs. Kamala stopped me at the gate. She had seen a reel, so naturally she was extremely confident. She said, "Doctor, all this is unnecessary. My sister's son, very big muscles like 2 coconuts. He told me the one true secret." She paused for maximum drama. I waited. The protein powder must enter the body within 4 minutes window, exactly 4 minutes after the gym workouts. Otherwise, completely wasted and gone. Mrs. Kamala, that is the timing in research that genuinely matters. It is just not the one your nephew is panicking about in the car park, stopwatch in hand, shaking a bottle like a bomb is about to go off. Sit. Let me show you the timing that is actually true. Doraisamy very earnestly asked, "Is it in tablet form?" His wife Meenakshi said, "No, Doraisamy. Here is a real timing story." And it comes from Skeletal Muscle Clock Review in Natural Reviews Endocrinology. Your muscle has its own clock. Not just the brain tells the muscle what time it is. The muscle fiber itself runs a molecular circadian rhythm, and the clock influences how your muscle handles fuels across the day, when it prefers carbohydrates, when it leans on the fat. And here is the elegant bit. Exercise itself acts as a time cue. The researchers use a lovely German word, Zeitgeber. It means time giver. The same workout done at different times of a day can nudge your muscle clock in different directions. And where it gets clinically interesting is this. In people with type 2 diabetes, the review highlights early work showing that high intensity exercise in the afternoon improved blood glucose more effectively than the very same exercise in the morning. Same effort, different clock, different result. Now the honest caveat, this is an emerging field. Not a lot of deep evidence is still in the mice. Human studies are early and small, and the authors are careful to say we are only beginning to translate this. So please do not hear that afternoon workout is magic. Hear this instead. The timing that matters may be circadian, morning versus afternoon, not whether you drink a shake 4 minutes after your last set. The best time to train is still the time you will actually reliably do it. The clock science is a polish on a habit. It is not a replacement for one. Mrs. Kamala quietly put her stopwatch away. Now let me close the loop I opened at the start carefully and fairly. The medical weight loss treatments are, in the words of the Lancet commend a genuine advance. They reduce fat mass effectively and deliver a real metabolic benefit that is not in dispute. And if you are on one, this is not a reason to stop. But here is the nuance the authors raise, that muscle loss seems largely driven by the sheer size of the weight loss rather than something uniquely sinister about the medication. Though they are clear that this is still needs proper testing, and the worry was never just the number on the scale. It is the pharmacy. Lose a big slice of muscle and you can drift towards what is called sarcopenic obesity. Not just excess fat weight, but excess fat combined with poor muscle health, which is exactly why the authors argue these treatments should be used as a part of the package, like medical care, enough protein, resistant exercises, and monitoring. The medication empties the fat. Your job with your doctor is to keep the pharmacy open while it does. This is general education, by the way, not a prescription. Your treating clinician owns that decision with you. So what do you actually walk away with? 5 things. Number 1, your muscle is a metabolic and immune organ, a pharmacy, not just something that carries the shopping. Number 2, if your knees ache, that is an argument for the right exercise, not against it. The Cochrane evidence puts structured exercise in the same general ballpark as anti-inflammatory tablets for pain. 3, to restock the shelves, resistant training, building gradually toward meaningful weekly volume plus protein around 1.2 to 1.6 grams per kilogram per day. 4, the timing that matters is circadian, not a 4-minute shake window, and the best time is still the time you will keep doing. 5, if you are losing weight, especially with the medical help, protecting muscle is not a side issue. It is the whole game. Talk to your doctor about doing it as a package. Your body already owns the most powerful pharmacy you will ever have access to. Nobody can prescribe it for you. No counter, no morning or evening collection. You open it yourself daily with a little honest resistance. And as for Doraisamy and his 3 unpaid jobs, Doraisamy said, "Doctor says my knee needs medicine, but my thigh needs responsibility." Doraisamy is the best summary of the whole video. I have put together a free 1-page guide, every number, every citation from today on a single sheet for the busy ones among you. The link is in the description and pinned in the comments. If this was useful, you know what to do. I'll see you in the next one. Disclaimer, this video is a general education, not a personal medical advice. It is not a substitute for assessment by your own doctor. Decisions about any medications, including medical weight loss treatment, are between you and your treating clinicians. See you in the next video. Until then, goodbye.